I'm Dr. Robert Fleisig. I'm a professor in the W. Booth School of Engineering Practice in the Faculty of Engineering at McMaster University. And I see a lot of familiar faces here, a lot of people that we worked with over the years, and some, of course, some new faces, students, current students, and some past students as well. So I'm delighted to see you all here. What I'd like to talk to you a little bit about is of course, this collaborative. This has been a long-term project that began initially, funny enough, as I recall, Rick, where's Rick? There he is, Rick. You remember, it was Mike that actually put us in contact. And now, I'm afraid to say it was probably about 9 or 10 years ago, if you can believe that. It's been that long. But it was actually that conversation that actually kicked off this work. And it's been Rick and I that have sort of co-chaired the steering group for the collaborative over all that time. And that has made we made a lot of progress, and I'd like to share some of that with you today. A little bit about why we're here. And I think one of the things that was obvious from the very beginning for both of us was the synergy between the two groups. Now, it is a bit of a David and Goliath situation. The Booth School is pretty tiny compared to all of St. Joe's, but the collaboration has really, really worked. What we bring, of course, is the technical knowledge, the students, the interest in education, innovation, and we share that common purpose of education with our St. Joe's colleagues, who also bring that incredibly complex and varied clinical practice and real-world environment. So where we're a department focused on practice, the practice comes in part here, in large part, providing that real-world environment through the hospital. What a great combination. So I'll tell you a little bit more about who we are. Who are the various people we've worked with and continue to work with. It's a very large cast of characters for sure. And I'll give you a little idea of where we've come from, where we are, and some thoughts of maybe where we could be going with the collaborative. But the thing I'd like you to really think about here is that the collaboration is intended to be a little bit more than a transaction. You're going to hear a lot about project work. And of course, that's the fundamental unit so far anyways in much of what we do. But we're more than that. The projects are very important, but without the relationships, it is just a set of projects. But I think you'll see that by working together, we've achieved a great deal more than we would have done by thinking about projects alone. 2017, I think, is about the time we originally started. And it started with a couple of projects working through dialysis. And I'm going to recall, maybe you can correct me if I've got this wrong, but I think one of the original projects was, maybe it was with you, Brooke? I'm trying to remember. I know the one with the King campus, the dialysis unit was one of them. We also did with the dialysis unit at the Brantford Hospital, in which a patient, I think, left a donation, and the students were tasked with working with clinicians and the patients to identify needs and make some recommendations on how the money might be best spent to improve the patient experience. So that was a seminal project, probably close to 9 or 10 years ago, that got us kicked off. And that project was really important because what it showed was that working with clinicians, the engineers and clinicians working together could do meaningful work and create important and valuable education, right? Especially when the projects were properly scoped, well supervised, and connected to real operational needs. In 2018, based on some of the early success, or we're feeling that we had did some valuable work, we set forth to put together a joint working group. And this involved a number of people. I don't remember all the names of the various individuals involved, but there were some very senior people involved at these meetings, trying to put together a little bit of a structure and governance behind the initiative, behind the collaboration. And so it involved, of course, faculty from the Booth School, and as well as clinicians, administrators, and support personnel from the Department of Education and Learning, which I guess wasn't a department yet at that time, and the Research Institute. And so over a couple of years, at a number of different meetings, we hammered out essentially an MOU, which has been a bit of a template for how we work since that time. Over each of these years, I mean, as you can see, it's probably 9 or 10 years, there was a cycle of developing projects in every year. So roughly the way it worked was we went through a 1-year cycle where we reached out to clinicians to identify problems and clinicians willing to work with us. We matched up the projects, people, and resources every year we went through a sort of a cadence and a process by which we, like I said, we found projects, we put students on them, we evaluated the work, and then we went back and said, how did we do? How do we make things better? Over those years, we've increased the number of projects. There was a bit of a lull through the period of the pandemic around 2020 to 2023. And we've also inserted some other activities on top of that that aren't strictly projects. For example, last year we ran a little bit of an AI policy workshop at McMaster involving some of the people in this room, students from the public policy program and faculty from the public policy program. Also, on an annual basis, I reach out to, and I don't think she's here, Victoria, with respect to PFAs, patient family advisors, something I learned about. So these are volunteers, usually former patients and family, sorry, patients, sometimes clinicians, sometimes family, that volunteer with the hospital to provide their perspective or patient perspective on things. And every time I reach out in the fall and the winter and ask, could I get a few volunteers from the PFA Council to work with my students, the design thinking course? And every time I hear back and it says, they absolutely love working with your students. And it's been an incredibly rich and opportunity for students to learn and for the PFAs to share their experiences. So again, thank you for that. And as you can see, every year we've been building a little bit, adding to the projects and gaining traction with the collaborative. And we've been moving. Originally, it was some people we met and we got to work with, to today, I can honestly say that I've got colleagues at St. Joe's that I work with on a regular basis. And that is a step forward, a major step forward. So what have we accomplished so far? Well, when we look back, it's very tempting to just count on the projects we did and those outputs and outcomes. And sometimes the very hefty reports that the students put together with the various deliverables to meet both the needs of the hospital and the academic requirements of our programs. Right? But when we think back about it, the students have come here and they've been thrown into an environment that is completely unfamiliar to them. It's required curiosity, it's required some courage, it's required a bit of humility, and for a lot of them, it's an awful lot of learning, and it's a little bit scary because it is brand new. We throw them frequently into programs, into projects that are quite open-ended, sometimes less so, but there's a great deal of uncertainty. And they have always persevered and found a way through, working closely with them. We've worked with all kinds of clinicians and staff across multiple sites and multiple units and departments of St. Joe's. Each relationship is one that's been cherished, and those clinicians and staff have brought forward projects and problems of all sorts in order to provide the authentic problems for the students to work on. Patients and families, we have engaged at times on some projects. Some projects are more technical than others, but our patients and families is something that I've learned that their voice matters in healthcare education. Right? We've worked with faculty both within the Booth School, and of course there are faculty from health sciences who have worked together closely to design and build student experiences that have led to complex learning. They've thought through practice-oriented experiences, constructed rubrics and evaluation mechanisms, and sat through many, many presentations and meetings and supporting students. And lastly, the institution itself has created that opportunity for us to work together to structure the projects, to create sufficient governance, support, and to provide the evaluation and opportunities for future growth. So like I said, our projects our work is not just projects, but there's a great deal more. We actually build capability with the various groups that we work with. So when we put together that agreement, we saw primarily 3 categories of projects. And this was sort of intended as a help us kind of categorize the work and identify which kind of faculty we'd like to place with each project and where it might sit in the hospital. But generally the projects end up some technology-centered, some more people-centered, and some more data-centered. And these are rough categories. Many projects had a foot in more than one of these categories, some possibly even on all 3. Right? So for example, Andrea Hemmerich worked on a number of projects involving, and she's actually in the photo here on the right, a digital scheduling project, which is really about technology, but it's also about people, workflows, constraints, and data. And every time we'd stepped a toe into one of these projects, we very quickly discovered how much more complex it was than we originally imagined it was, which was a very good indication of the reality and a very good indication of the level of learning the students were going to get. So the projects were not abstract exercises. They were grounded in targeted challenges identified primarily by St. Joe's clinicians and supported through a practice-based framework. Over time, the work has shown that the best projects are not simply technical assignments. They are opportunities for mutual learning. All right, so those are my words. And what we have here is a video that Richard put together. I'll start in just a second. And these are the words and voices of former students who have graduated from our master's programs in the Booth School, and all of which participated in some way in a project here at St. Joe's. And you're going to hear what they have to say about it.
My name is Joe Kagumba. My program was engineering design, and my graduation year is 2025. Our team created Guardian Angel, a suite of tools to support home care professionals as they transitioned patients from the hospital to home. A lot of home care professionals often go into unfamiliar environments. So we built a suite of tools that supports them with situational awareness. St. Joe's and the home care team were essential to the project as they gave us opportunity to understand the real context of the problem, giving us access to the nurses, home care professionals. We had a lot of conversations, understood frontline perspectives, and got a lot of stakeholder input into the entire process. This information was key to building a product and ensuring it was grounded in truth. The solution we were building couldn't add friction to the home care professional's day. We had to ensure our engineered solution didn't increase the cognitive load of these professionals. And so understanding the environment and the context in which the product would be used was essential. As I was working through this project, a lot of the AI tools were being built and progressing. Getting a hands-on experience working with these tools is something that I found was essential. Practicing with them is something that I found was very useful and really helps me now, my day-to-day work. I still talk to a lot of my colleagues and a lot of the folks who I worked with at St. Joe's Hospital. I'm still friends with them, and we're actually working on a few projects together right now. I would like to simply say thank you for your immense support and dedication. The St. Joe's staff really supported me as a learner. Understanding the hospital system is something I didn't really have a good grasp of before I entered the program, but after I entered the program, I got a whole new perspective on the environment and has definitely supported my learning and education moving forward. Thank you.
My name is Doris Senchidebra, and my program of study was a Master of Engineering and Public Policy at the W. Booth School of Engineering Practice. With AI being introduced into healthcare systems, we wanted to explore how institutions can evaluate AI tools and ensure they align with clinical, organizational, and ethical standards. This included developing a structure for an AI governance committee, as well as a set of evaluation criteria for organizations that organizations can use and assess potential AI applications. We also examined 3 real-world use cases: AI-assisted CT screening, predicting pressure injuries using cognitive computing, and a clinical tip sheet system to test how these criteria could work in practice. The team at St. Joe's Healthcare Hamilton played a key role throughout the project. They contributed to real-world expertise by participating in stakeholder workshops, sharing practical insights from clinical and operational perspective, and helping us validate evaluation criteria using the DEFI method. Their inputs ensured that the framework we developed was grounded in real-world healthcare challenges rather than just theory. From this experience, I learned how important collaboration and interdisciplinary perspective are when working on technology in healthcare, bringing together clinicians, policy experts, and technical professions helped highlight different priorities such as patients' safety, data quality, transparency, and equity when evaluating AI tools. We learned on the job, we learned from the reality. They weren't abstract. The things that we learned were real, in real time. And that's make meaningful contribution into our life going forward. I would like to thank all this subject matter experts at St. Joe's Healthcare Hamilton and the home care team for their guidance, collaboration, and openness in sharing their expertise. Their support made this project both meaningful and impactful, and we truly appreciate the opportunity to learn from their experience.
So the agreement that we put together some years ago had some, well, fairly lofty words. And I read back of these and said, wow, that's what we aim for. And I think we've come a long way. Our mission that we defined as combine the best in healthcare practice and engineering education to advance quality outcomes for patients and families through hands-on teaching, learning, applied research, and technology, with the vision that to eventually become a global leader in this space at the intersection of healthcare practice and engineering education. All that based on the assumption that we build effective relationships, which I think has been a key element of this collaborative, that we aim for innovation in both healthcare and in education, and ultimately that is underlined by supporting work that meets high levels of excellence. So we've put together an agreement that was open by design, enough to give us room to keep working, adding, increasing, widening the scope of people we work with, the kinds of projects we work on, and the kinds of activities we undertake, but enough to provide support so that we can move forward effectively and work collaboratively. Originally, one of the visions that was put forward, I think this actually, I remember, Rick, you told me this, right? And I don't remember the exact words, but the idea was really simple, that one day, we're hoping going to see that having engineering learners at the hospital is as normal and as usual as having health science learners in the hospital. Right? Maybe we're not there quite yet, but I think we have come a long way. Engineering learner is not going to be the same as a health sciences learner. They have a different role, they have different responsibilities, and they have different needs. Right? But it does assume that our students coming in are going to be properly oriented, appropriately credentialed, supervised, and trusted. It also means that clinicians understand who they are and how they work a little differently than health science students. It also means that students come with an understanding of the gravity of working in a healthcare environment. Right? This is not an academic project. Right? And it also means that the projects that we pick must be something that is aligned, of course, with the educational needs, but connected with real needs of the people in the hospital, clinicians, patients, and others. So in a sense, what we're saying is we don't want engineering thinking to be simply something occasional in a hospital, but something that becomes part and parcel of the kinds of work and thinking that happens here every day. And we're hoping that one day, despite the fact that this might be seen as a novel approach of bringing healthcare and engineering together, that eventually get to the point where it's no longer exciting or surprising because it is simply the way we work every day. And that we've moved from a new initiative to something matured in time. So to achieve that sort of normalcy of treating engineering learners as any other learner in the hospital does take a few things to happen. For one, we need access, and have gotten this in many cases in all our projects, clear pathways to appropriate clinical and non-clinical settings. I've had many occasions where students working directly with clinicians, the clinicians act not just as a source of a challenge in project, but they oftentimes are gatekeepers to other aspects, other people in the hospital, other places, and other resources. We've, over a number of years, have developed an onboarding procedure, bringing students on board into the program, into the hospital, in a way that treats privacy, dignity, and professionalism as paramount in everything they do. We continue to refine that process and improve it as new needs come up and new challenges occur. If we make this work, we also need trust in a way that clinicians and staff will bring forward real problems because they believe the engagement would be respectful and useful. It also requires continuity. In many of these projects, what happens is, certainly in the past, you did a project and that was it. There was an outcome, but no other progress. And when we've had some success in recent years of running projects actually over multiple years, where one group of students does some work with an output and that's passed on to a new cohort the following year. In fact, the Rapid Rounds project, which you've now heard of at least twice, and you will hear yet again about, has now in its 5th year of work, moving towards real implementation of some of the outcomes in a clinical environment. Little by little, we're going to get there. And we're learning all along as we move forward. Supervision is another piece that's important, and because what happens in the projects we've learned is that the clinicians also become part-time educators in this process as well. We get their help to provide coaching to the students, to provide guidance, and to participate in helping formulate and frame a project that really works for everyone. And sometimes that's an enormous challenge. We've seen numerous projects go where there are numerous pivots in the project in the early months, sometimes going to quite some time before a project is clearly defined. And I think some of the students that are here today will be able to speak to that at a later point. So we've anticipated through the agreement that we need places for evaluation, annual reporting, and continuous improvement. And if we want engineers to become a routine presence at the hospital, we need also evidence to make sure that what we're doing actually does work and does deliver on the value that we say we are creating. So what's left to be done? So these are really my thoughts on some of the steps, or some of the things that we may be able to look into as we move forward. Some of which, of course, I discussed with my colleagues, both at St. Joe's and at McMaster. So continuing to broaden and diversify the kinds of projects we do across hospital units and sites, and increase also the diversity of faculty from the W. Booth School that are involved in the projects. You've seen that infrastructure has grown. This space is an example of how the infrastructure has expanded and grown to encompass not just health sciences learners, but also the engineering learners. And we need the infrastructure not just from a physical space, but also from a digital space. Being able to perhaps imagine some future point where we have a sandbox for students working with Epic to work with. We're maybe not there yet, but that might be a possibility for the future, creating real-world digital work environments, not just physical ones. Ultimately, we'd like to expand our impact, I think, beyond what we've done today, beyond just a single project. How can we work towards dissemination in scholarly publications, whether those are healthcare related, engineering related, or in education related? Where is it the opportunities here that we can pursue involving in taking those projects developed by students and turning them into commercial viable outcomes of one sort or another? And ultimately communicating our work to a broader audience simply beyond healthcare and beyond education. All that, of course, will require sustainability in terms of the resources to make that happen, the leadership transitions, funding pathways, and institutional memory to ensure that we're able to move forward. So one way to imagine what that might look like is a lot of talk so far about projects, but imagine this not so much as a series of projects or a compendium of projects or a binder of projects, but rather as a platform, a way of working together and holding all this work in one envelope. So our typical cadence, as I've suggested before, is an annual call for proposals, followed by a scope and match, that is addressing or finding ways of connecting students, projects, and clinicians and the appropriate resources. Learning and delivering on that actual project. To the green is where the project actually happens. In that timing, it depends on the program. Evaluation and reporting, and eventually annual revision of the program and the supports to make sure that we're doing the best we can. So this is moving us away from a project mindset that says, what have we accomplished with each project separately? What have we produced? To one that says, how can we learn from what we've done collectively every year to improve everyone's future project, not just the one outcome? So in closing, I just do want to thank the various the broad range of groups that we've worked together with. First of all, students. Thank you for bringing your courage, curiosity, and professionalism and the willingness to learn in a very unfamiliar environment. You have represented engineering in our school, the Booth School, not simply as a technical discipline, but also a way of serving your community. To the clinicians and staff, thank you for sharing your time, your context, your trust, your knowledge, and the real problems that you've brought and invited learners into your workplace to work with them, sometimes on high-stakes projects. To the patients, families, and PFAs, thank you for sharing your lives and healthcare experiences, for enriching the lives of our students and the faculty, all of whom have been learning from the experiences that patients have at the hospital. Thank you to my colleagues, faculty both in healthcare and in the W. Booth School, for all the hard work that you have done in helping guide students through the projects to grow their capacities and to coach them through some of the uncertainty that the projects inevitably entailed. And lastly, to the leaders and champions at St. Joe's, thank you for making the space, removing the barriers, and protecting the long view so all this could happen. So it's not just a piece of paper that sits on the shelf, but it actually happens because we all come here and do the work to help students learn and improve the healthcare delivered to patients. Purpose, people, and progress. So returning to my original message, that trying to treat this as a relationship rather than a series of disconnected transactions or projects. By bringing people together, by concentrating on the collective aspect, we take the projects and we've embellished them, we've amplified their outputs, we've amplified the learning and the impact, and we're taking our students and learners from being simply someone new and unusual in the hospital and making it something that should feel just normal and everyday and is better for everyone, because we focused on relationships building, on making things innovative, and ultimately on doing it in a way that truly exemplified excellence both academically and in patient care. Thank you.